Hello, my name is Dr. Paul Lejdurian, and I am a spine surgeon at MedStar Union Memorial Hospital. As it turns out, I am also a spine surgery patient. Most patients undergo surgery because it's a quality of life decision. I personally had to make that decision, and when it got to the point that my professional career was suffering because I was in chronic pain, and my personal life was suffering, I couldn't enjoy the things I wanted to do, that's when I decided that surgery was the right time for me. Once you decide on having spine surgery, there are several things you can do to prepare. You want to prepare yourself physically, and you want to prepare your environment. You want to make sure that you're exercising. You want to make sure you're eating well. If you're a smoker, you want to stop smoking. I personally lost weight. I lost about 10 pounds before surgery to be in shape. And when I got home, I wanted to make sure my house was safe. I obtained a raised toilet seat. I made sure I had someone around who would help me for a couple days. These are all things you can do so that your pre- and post-operative recovery is optimized. After your operation, the hospital will provide you with pretty much everything you need. One thing that I found that was very helpful was a shirt that's soft, and it's a wicking shirt, so it prevents you from sticking to bed when you move around in bed. That's very helpful. When you go home, there's some tools that will be given to you by occupational therapy, and I find that the grasper was something which is great, since if you're dropping things on the floor like I do on frequent occasions, this is very helpful so you don't have to bend over. And then the tool I use even today is a long shoehorn, which helps get your shoes on and prevents you from bending over. These are some of the things that are helpful in your recovery. After your operation and rehab, you should be better, and that's the goal of surgery. But once again, it comes back to expectations. I know now that I can go back to the operating room and feel good in the OR. When I'm outside the hospital, I feel great at home doing everyday activities. I am, however, modifying my lifestyle. I'm not going to be lifting heavy bags of mulch or helping lift heavy furniture. And I think that's an important thing to consider. You don't have a normal back after having an operation. The goal is to work smarter, not harder. In retrospect, was the decision for having surgery the correct one for me? Absolutely. I no longer have chronic back and leg pain, so I can enjoy life. I enjoy time with my family and my friends. And just as important, I enjoy doing what I've dedicated my life to for the past 40 years, which is helping patients. And I can do it without being in chronic pain.